What's up, guys? Thanks for tuning in to this quick presentation entitled Simulation Training for Medical Emergencies in Your Dental Office. My name is Brian Oglander from Southwest Oral Surgery, and I want to introduce you to what simulation training is and how you can implement that for your office and improve how your team would operate in case of emergencies, and just to help perhaps make you a little bit more confident that your office is better equipped to handle an emergency in case one were to arise. Remember, there's a high likelihood a dentist will experience a medical emergency in the office, and while most of these are mild, approximately 10% will be considered serious. Majority of the patients with a serious issue have some underlying disease. The ADA Commission on Dental Accreditation from 2016, dentists must be competent in providing basic life support, including CPR skills, and be able to manage common medical emergencies. So what is simulation? It's an opportunity to practice procedures in your office with relative safety of the environment. We can demonstrate multiple patient problems. These problems are reproducible. We can practice them, and there's an ease of simulating the event. Deliberate practice is an educational technique to increase performance. By repetition, knowledge tends to stick a little bit more. There's assessment. Somebody's reviewing our skills. There's feedback, usually in the form of a debriefing session, whereby we get some information on how we performed, as well as hopefully performance improvement. Different simulators available to us. Certainly the task trainers, like we are familiar with the Recessi Annie for CPR. We've all used these before. If you move on to advanced cardiac life support, we have the computer-based training. There are patient usage simulators whereby real-life patients are simulating an event. And there's also usage of mannequins that are a little bit higher in fidelity. Some of them talk to you, some of them respond, some of them can have blood pressures measured. These are high and low fidelity mannequins. In a study in 2009 in the Journal of Dental Education, managing a cardiac arrest evaluation of final year pre-doctoral dental students, none of the final year dental students were able to competently manage a cardiac arrest, even though 50% felt they were capable prior to the simulation class. Therefore, didactic and CPR BLS classes are not enough to make sure that somebody's really equipped to handle a cardiac arrest. In another study, ability of dental students to deliver oxygen in a medical emergency. When presented with a case of angina pectoris, only 68% of 43rd and 4th year dental students identified the need to give supplemental oxygen. Of those, only 50% administered the oxygen correctly. Rapid deterioration of basic life support skills in dentists with a basic life support healthcare provider card. This is another study from 2016 in Anesthesia Progress. The time taken to perform CPR or reaction times are prolonged, and the quality of CPR skills deteriorated rapidly when CPR was not performed regularly. Pediatric residents, their resuscitation skills deteriorate over the 12 months following their initial PALS course. Levels of knowledge and skills decrease rapidly, even more significantly during the second year of training when no refresher PALS course is offered. So what role does simulation provide? Rigorous simulation-based medical education can contribute to better patient care and improve patient safety. How about the sequence of instruction? Does that matter? This is from a study in simulation healthcare in 2014. Simulation before a lecture generally showed recipients had increased knowledge. However, the participants preferred to have the lecture prior to the simulation event. So usually the timing of when to engage learners depends on the amount of previous knowledge they possess. Working as a team, lack of communication creates situations where medical errors can occur. The Joint Commission on Accreditation from Healthcare Organizations in 2006 found poor communication is the root cause of 70% of adverse events. So we can practice many different team dynamics during a simulation exercise. We can practice closed-loop communication, clear messages, clear roles and responsibilities, knowing your limitations, sharing knowledge, constructive intervention. We're going to go through some of this in detail after this presentation. Most simulation exercises include a debriefing session. Following a simulation exercise, it's a conversational period for reflection, feedback aimed at sustaining or improving future function and future performance. Instead of measuring the quality of the participant's performance, we focus on the attitude and the self-assessment toward emergency care just to improve the quality of outcomes. Hopefully, through a simulation exercise, you achieve competence, acquisition of knowledge, skills, and abilities at a level of expertise sufficient to be able to perform in a work setting. So usually, participants report simulation sessions are very worthwhile, realistic, challenging, and almost universally emotionally positive. So people feel good when they participate, and they feel like they have knowledge that they can apply in the future. So the benefits of a simulation exercise for your practice is you get to practice skills you do not use on a regular basis. You can practice managing emergencies that are very rare in your office. It's a great team building exercise. And it's a good way to gain confidence you are providing the safest healthcare environment for your patients. So how do you prepare for your upcoming simulation exercise? First of all, you review the attached components of successful communication that follows this video. You read through that, think about how you can implement good communication in an emergency. There's also an attached simulation patient medical history. You want to print that out and review it with your office. We want to assign a team leader. Make sure you know who the person in charge of any type of event is going to be. We want to know who retrieves the medication kit. We would assign somebody to do that. Who's going to go get supplemental oxygen if we feel that's necessary. Who's going to call 911 and record any events. These are all important parts that we want to have put together and ready for our simulation course we're going to undertake. Hopefully this has piqued your curiosity and interest in a simulation event for your office. It's a great team building exercise, and certainly the benefits are immense for your office. Thanks for listening.